Hi, welcome to the pack. All of your organs are affected by a fatty liver. You know, there's this idea that if you have a fatty liver, it's an isolated problem, it's an individual problem that is probably not related to other organs. That is actually not quite true. If you have a fatty liver, and we can see this on CT scan or ultrasound, we know that the other organs in your body are affected. The first organ is your heart, and it doesn't take a genius to figure out why an overweight person with diabetes and elevated triglycerides in their bloodstream has an increased risk of heart failure. Heart failure is an organ disease that's caused by a fatty liver. The next organ is your brain, and you can see how if you have elevated blood sugars for a prolonged period of time, the risk of having a stroke increases over time, because good blood flow to the brain requires healthy endothelial function in order for those endothelial cells to produce nitric oxide. Nitric oxide brings blood flow to the brain, and if you have elevated blood sugars for a prolonged period of time, the endothelial cells are damaged. They produce less nitric oxide, so good blood flow decreases, meaning that it's harder for your brain to function or causes an infarct, which is basically a stroke. The next organ is your kidneys. I've already given a lecture on kidney disease, and it's all about elevated blood sugars over time. So if you have a fatty liver, the risk of developing kidney failure increases, because as those endothelial cells are damaged from high blood sugars, they can't produce nitric oxide at tip-top shape to bring good blood flow to the kidneys. The next organ is your liver. Your liver is always affected when you have a fatty liver, because it's overworked by processing toxic waste products that are produced from both the normal cell turnover, but also from fat breakdown. When you have excess body fat, there are certain chemicals called Dicarbonyls which are formed that are toxic to your liver. Dicarbonyls cause inflammation in the liver. Inflammation is bad for your liver. And you know what's worse? When those dicarbonyl toxins leak into the bloodstream and go all over the body, causing even more damage. You can see how this happens when you look at the role of endothelial nitric oxide in the cardiovascular system. Nitric oxide is what's responsible for vasodilation, which means to open up your blood vessels in order to increase blood flow. Nitric oxide production in your liver is important because it allows it to have good blood flow, but if you have high sugars for a prolonged period of time, the endothelial cells in your liver are damaged and don't produce enough nitric oxide. The nitric oxide produced by your liver is reduced, which limits blood flow to that organ. Blood flow to your liver determines how well it can remove toxins from the bloodstream, which means that if you have high sugars for a prolonged period of time, the hepatocytes, liver cells, in your liver will become damaged. Toxic byproducts like dicarbonyls build up, which cause more damage and inflammation to your liver. The inflammatory process is called NASH, or non-alcoholic steatohepatitis, and it's a precursor for liver failure. Now the bad news is that NASH has a very close relationship to type 2 diabetes. In fact, it's not just related, but you have a 25% chance of developing liver failure if you have chronic hepatitis C, and a 20% chance of developing liver failure if you have NASH. That's why I'm always asking my diabetic patients if they have elevated liver enzymes, because it's also a red flag for fatty liver disease. NASH can develop in anyone, but is usually associated with obesity, metabolic syndrome, heart failure, and type 2 diabetes. The last organ I want to talk about are your kidneys. The same way that endothelial nitric oxide production is important for your brain, kidneys, and liver, it's also very important for your kidneys. When you have high blood sugars for a prolonged period of time, the endothelial cells are damaged in your kidneys, which limits their ability to produce nitric oxide. Good blood flow is critical to filtering out toxins from your body, which means that if you have high blood sugars for a prolonged period of time, your kidneys are at risk of becoming damaged. Your natural filtration system will kick into overdrive in order to help keep your blood clean, which means that you start producing more urine, but it's not enough, because these toxins need to get flushed out of your body through the kidneys. The kidneys start to fail because they aren't able to perform their job efficiently. Now, this is a problem because your kidneys are responsible for balancing the electrolytes in your body and filtering out waste materials too. You can see how damaging high blood sugars over time can lead to chronic kidney failure, which is why it's so important to take care of yourself and keep your blood sugars in a healthy range. The kidneys are responsible for regulating blood pressure, but also play a role in insulin production. When you have high blood sugars chronically, you can damage your kidney's ability to produce glucose, which means that over time your pancreas needs to kick into overdrive in order to keep up with the demand for insulin. All of this extra work eventually leads to burnout for the pancreas, which is what causes type 2 diabetes. I hope this short video can help you better understand how high blood sugars damage your brain, liver, kidneys and other organs in your body. This also gives you a greater appreciation for why it's so important to manage your blood sugar levels by eating healthy foods. So if you have a fatty liver, you also have fatty organs. They should really call a fatty liver just fatty organs, because the fat is going to spill off into your muscles, into your heart and vessels, into the pancreas, into the kidney and many other organs. Now, what's the significance of it? Well, the more fat you have in your organs, the less function you're going to have in those organs, and you're also going to get inflammation. So for example, the more fat in your liver, the less your liver is going to be able to produce bile, the less your liver is going to be able to convert poisons into harmless particles, the less the liver is going to make certain proteins in your blood which end up giving you edema in your legs, the less the liver is going to make certain clotting factors, and the more you're going to have bleeding and issues with if you bruise yourself. One of the best predictors for a fatty liver is ALT. That's a liver enzyme test. So if you have high ALT in as a blood test, chances are you have a fatty liver. Another good test would be high levels of triglycerides, probably because the body now doesn't have the capacity of bile salts or bile salt production to be able to emulsify and break down those triglycerides and get rid of them. And the other problem with the fatty liver is up to 20 of people with a fatty liver end up having cirrhosis. That's scar tissue of the liver. It's much more serious, and you have a lot of other problems, including being on the list for a liver transplant. Now the question is, how do you reverse a fatty liver? If you haven't seen my video on how to reduce liver fat by 50 and 14 days, I put a link down below. But you need to get on a low carb diet. You need to reduce your insulin. When you reduce your insulin, another hormone comes in there called glucagon, and glucagon rapidly burns fat. It turns fat into ketones, and glucagon is triggered by low insulin or a low carb diet. Alright, thanks for watching, and we'll see you in the next video. Hey, before you go out, you're benefiting from any of my content, I would love to hear about your success story. Please share it in the link down below. Like the video, share with friends, subscribe and join the pack.